Hi, this is Mark Desimone. I'm the CEO of Aegate, the leading medicine verification system in Europe. In a few days and weeks, you will be called to make an important decision in your country. If you are a manufacturer of pharmaceutical products or an association representing manufacturers, or a wholesaler or an association representing wholesalers, or a pharmacy or pharmacy owners and the association representing you, together with your national regulator and your health authorities, you'll make a decision on how to implement the medicine verification service in your country. To do this, you'll select a medicine verification service provider. Aegate is the leading medicine verification service provider in Europe, with over 3.3 billion medicine tags already verified. And as an expert, we've been working with the European Medicine Verification Organization and closed a framework contract and a national standard contract to be able to offer this service. But in making this decision, what we want to make sure you understand is what are the risks and opportunities in this decision. And the fact that the real key is not all the technicalities that we will talk about, but the trust in the ability for the service provider to deliver what it says. And we want to take you through a few questions you must answer for yourself. First and foremost, this is an end-to-end system. What we mean by that is that when the pharmacy scans a product, that the service provider needs to guarantee that the verification is executed within a time frame of a quarter of a second, 300 milliseconds, so that it doesn't have any impact on the way that the pharmacist operates. The service provider needs to guarantee that that happens. And if you don't have one that looks at the end-to-end, this service provider, as Aegate does, is able to guarantee that this performance is executed, but not as a project or a pilot. In the case of Aegate, we have guaranteed this for over 3.2 billion transactions of this nature at a 99.998% of quality. That means we are experienced. And that's why the European Commission has asked us to help and design this system. So the first question you should ask yourself, as the service provider, the experience and the knowledge of all the things that will go wrong in a system like this, do we guarantee it? Does the service provider guarantee it if the internet goes down? Does the service provider understand what happens if the pharmacy scans it twice by mistake? All of these practical issues are key to this decision because the service provider needs to be there as an expert. The second issue you want to understand is, are there hidden costs that I didn't understand? And frankly, as you are dealing with a subject matter that is not the subject matter of the manufacturer or of any of the providers, but is very specialized, you need to ask yourselves, what are the things that will go wrong, can go wrong, and have I taken into consideration the total cost? If you've got different players providing parts of the system, and not one that takes the responsibility overall for it, how can you ensure that you have bound the cost? At Aegate, we have given you a value proposition with a flat price, meaning in that price, in that cost, everything is included. If you're a hospital, the integration of your service is included. If you're a pharmacy, it is included. We've included working with all the software providers because that's what we do, and that's how we leverage the basically 9,000 or 10,000 people in the 71 companies with whom we work with. So we have already experienced how we can deliver a service across the 200,000 pharmacies in Europe and many thousand hospitals. So a question is, do you understand the hidden cost? And if those hidden costs are not guaranteed by the service provider, they will go to the manufacturers that has to pay again, and the National Medicine Verification Organization. Have you considered that fact? The third issue you need to ask yourself is, do you have enough time to actually do this? We are encouraging every National Medicine Verification Organization to make a decision in 2015 because time is of the essence. People tell me, well, you know, we've got 3 years. No, you don't have 3 years. The last year will be testing the real live manufacturing codes that will come from the manufacturers. And it'll take 6, 9, 12 months. That means you really have 2 calendar years. But as you know, 2 calendar years are roughly 16 months because of all the other vacations, holidays, and times where the country is really not working. So 16 months for 28, 33 countries, the service provider needs to guarantee this. It's got to be a very specialized service provider. we are such a company. We've been created 10 years ago with over 100 million euros of overall investment to ensure that at this moment we will be ready to actually help you along. And whether you're in Romania or Finland, whether you're in Ireland or France, whether you are in Spain or Germany, we're there with dedicated personnel that understands medicine verification. And the ecosystem of our partners, our 71 partners that are becoming about 120 over the next two or 3 months, are there to guarantee with their 9 or 10,000 people that we can actually deliver what we talk about. And because we have experienced it, we've got the data to prove it. So in making this decision, the real cost is not just the cost of the system, it's not just the fact that you need to have the quality within the cost, it's not just the fact that in that cost everything must be included, but it is also about the timing. You've got to start right away. And what we have done through the European Medicine Verification Organization and integrated into the European Hub is created a value proposition that is simple to understand and simple to make a decision for. Whether you're already a fully functioning national medicine verification organization or you're just a joint stakeholder group that wants to select Aegate, all we need to know is that you've done so, and then we'll start working with you. So just to take it to the action item is we have been to your countries, we have met with you, we have been available to ensure that your knowledge of what we do is there. You know our faces, you know our teams, you can speak in your local language, whether it's Spanish, French, German, we're there. It now takes a two-way street to sit down. We've got a verified contract from the European Medicine Verification Organization. It's there. It will make the negotiation much faster. And in our value proposition, we have included all of the costs you'll ever need, and therefore it's a limited risk in your decision. In fact, we've taken the risk away, and we've taken the implementation risk away, and of course we've taken all of the variable cost of things you may not know away. So fundamentally, you're buying a secure, guaranteed system. And when you talk to your, basically if you're an association, you talk to your members, and of course the members of the pharmaceutical companies will have to pay for this. They can rest assured that you have bound the risks, not just with quality, with the best quality that you have, but with cost and with an all-inclusive price that guarantees that the system will operate. Words to all, please start getting involved in calling us in terms of starting the decision-making process. We can also share our knowledge, our experience, so that you're not going to fall into some of the traps in this decision, and that you can benefit from our 10-year experience in this field as the only provider whose company is solely focused on the benefits for patient care and for patient safety of the medicine verification and the falsified medicine directive. We look forward to seeing you in your country very soon. Thank you very much.